So we're back. It's a Monday. We promised you every Monday here on the show in this month of October as we seek to create a lot more awareness on breast cancer. We'll bring you conversations here on the show. And I'm happy that we've been joined by Dr. Na Adokoy Aite. She is a specialist radiation oncologist from the National Center for Radiotherapy and Nuclear Medicine, Kolebu Teaching Hospital. She was here last week. When we started talking about what the disease is in the first place, we looked at a few statistics, scary statistics, by the way. We'll continue with our conversation this morning. Thank you so much for your time again.
I'm happy to be here.
Yeah. How did the lunch go?
It was good. The First Lady was there. The rank and file of Kolebu was around as well. And we have some ambassadors, Media Force and the wife of the Vice President. They were all around. It was a good event.
Oh, she's an ambassador as well?
Yes.
Okay, that's nice.
And the First Lady, actually.
And the First Lady is also an ambassador?
That's right.
Okay, so what are they supposed to be doing?
So they'll be sending messages. There are recorded messages that they'll be playing on the media, yes. And it's good that they've joined us, because it gives people can understand that it's an important issue. Usually when you have big people joining a campaign, then it gives a bit more seriousness to it. So we are really grateful for them to have joined us. Okay,
so we're continuing with our conversation today. All right, and we're talking about diagnosis.
Yes.
All right, take us through. What should we know?
So breast cancer can present in so many ways. Okay. Unfortunately, there's a particular one that's more common in Ghana. We'll talk about that. However, you can have someone with breast cancer who has no symptoms at all. So even on the breast, you'd see nothing. The only thing you find is when you do a radiological investigation. So if you did a mammogram, then you'd find what we call microcalcifications, which are abnormal. Then you go in to take a biopsy, take a sample of it, and then you find out that it's a malignancy. The other way in which a patient can present is that they can present with a small lump in the breast. Not much change on the breast physically, but then when they have a feel of the breast, they'll find a discrete, usually hard lump. So another person can present that way. Then there's the more common one where patients come in with enlarged, unfortunately ulcerated, sometimes foul-smelling breast, which shows cancer that's gone on for a long time. There's a last one. It's not a very common type of breast cancer, but we are happy it's not, because it's not a very good one. That one occurs suddenly, and the breast is enlarged, red, and very painful. So that's the other way that the patient can present.
Okay. And whilst you do these tests, are they painful?
Not all. No. The mammogram, people complain it's a bit uncomfortable.
Okay.
Because what it is that your breast will be put in sort of a compressor to spread out the fat so that they can properly examine the breast. So that may be a bit uncomfortable.
Whilst they're doing that, what are you doing? Lying down or?
No, you are bent forward.
Okay.
And it's pressed together.
Okay. How long does that process take?
Not too long, maximum 50 minutes. A lot of the time is really repositioning the breast to make sure that the view is a good one. That's what takes long, but the process itself doesn't take long at all.
Okay. So that may be a bit comfortable.
A bit uncomfortable, yes. But the rest are not painful at all. So let me say this. There are 3 things that every doctor should do to decide that you have breast cancer. And please, if your doctor doesn't do that, be uncomfortable and say you want to go and see someone else.
Second opinion.
Exactly.
Okay.
So there are 3 things. The first thing is examining the breast and having a look at the way the breast is. So usually you have 2 breasts. One may be bigger than the other. That's normal. Sometimes even one is much bigger than the other. That may be normal as well. And I always say it doesn't matter what size of breast it is. The main purpose of the breast is for breastfeeding. And small breasts are able to breastfeed. Big breasts are able to breastfeed. When you stand in the mirror, you are supposed to have a look at the general look of your breast. The skin, the nipple and areola area. So that's the nipple is what the baby feeds on. And the areola is the darkened area close to the nipple. You're supposed to examine there, have a look. Is there any changes in the skin? Is there an ulceration at the nipple? If you are not breastfeeding, that may be a concern. The look of the nipple, is it pointing outwards? Most people have their nipples pointing outwards, and that's normal. There are few people who have inverted nipples. If you've had an inverted nipple all your life, that's normal as well.
Kindly describe that.
So you see the nipple is usually out, and there's a rounded bit that the baby can feed on. There are some people who don't have nipples like that. It's a slit, and so there's no obvious protrusion from the breast. That's normal if you've had it all your life. It can be unilateral, so it can be on one side or it can be on both sides. But if it's been like that the whole time, then it's not a problem. However, if you had a nipple that was everted, looking outwards, and suddenly it's gone in, then you should be worried and go and seek a doctor's opinion. If there are any ulcerations on the breast, it's a concern. And then when you've examined the breast and you felt a lump, it's usually painless, it's hard, it may be soft sometimes, and it's not very mobile. There are other kinds of lumps in the breast, especially in young women, and those are very mobile and usually soft. That's
when
different.
You say mobile, what do you mean? It moves around?
It moves around. So when you try to hold it, it's virtually impossible. It's actually described as a breast mouse, because when you try to touch it, then it moves around. Exactly. But that doesn't happen with the breast cancer. It's usually fixed, and it may or may not be attached to your skin or the underlying tissue.
Okay.
So that's the clinical thing. And your doctor must have a look at your breast completely, have a feel, touch it, all of that. Then subsequently, they'll ask you to go and do a radiological examination. And the type you do is based on your age. If you are more than 40 years, you do a mammogram. The reason is that the younger breast is very dense, and the mammogram is not able to penetrate enough to show the tissue. So more than 40 years, you do a mammogram. If there's a need, they will do an ultrasound scan as well. And for a few people, we may ask you to do a breast MRI.
Okay.
But for people who are younger than 40 years, a breast ultrasound is good enough to assess if there's any abnormality. So that's the second.
Do you go through a certain equipment?
Oh, it's a mammogram. The ultrasound scan is pretty much like the one for assessing a fetus.
Okay.
So a gel is put on the breast, and then the probe is moved on the breast. Yes.
Okay.
And then the third thing that the doctor is supposed to do is to take a bit of the breast and take it for pathology.
Take a bit of the breasts?
Yes, a sample of the lump.
Okay.
And take that for pathology.
What would that mean? Cutting through?
You can't do that, but we don't usually encourage that, because at the point you are cutting through, you don't know if it's a cancer or not. So it's better to use a needle, what we call a core biopsy needle, and that is it's a slightly wide bore needle, and a sample of the tissue is taken in the form of a gun.
Okay.
And that is looked at under the microscope. That is the only way we can confirm that you have breast cancer. So we have how it looks clinically, how it looks radiologically on the mammogram or ultrasound, and what the pathologist says.
Okay.
Usually all three must be pointing in the right direction. There are few occasions where it might not be too clear, but when that happens, then you need to do further tests to make sure that it is a malignancy, because the diagnosis is a big diagnosis. You don't want to tell somebody it's a cancer when it's not. And you don't want to tell somebody it's not a cancer when it is. That's
okay.
Right.
So what it means is no doctor can look you in the face and tell you that you have breast cancer?
No, the best they can do is say, I think you may have breast cancer. But they cannot look at you and decide you have breast cancer.
Okay. A prophetess can also not tell you that you have breast cancer?
I haven't met one yet.
Okay.
I haven't met
one.
So
after you go through this diagnosis, then what next?
So once we've confirmed that you have breast cancer, then we need to go through the process of determining the extent of your cancer. So like we said last week, cancer can metastasize or move to other parts of your body. And once we've diagnosed that you have breast cancer, usually if the lump is more than 5 centimeters, we will have to do other investigations. So we'll have a look at your lungs, either through a chest x-ray or a CT scan, to make sure that the cancer hasn't gone into your lungs. The other common site it goes to is your liver. So we'll ask you to do an ultrasound scan or a CT scan of the abdomen to make sure it hasn't gone there. Other tests we do only when the patient complains. For example, if a patient who has cancer, maybe locally advanced because it's ulcerated and everything, starts complaining that they have pain in their back, for example, or they have hip pain, then we'll do tests on the bone to find out if the cancer has gone into the bone, because it can't go into your bone.
Okay.
And then if someone comes and complains of headaches, for example, severe headaches, vomiting in the mornings, we need to do a CT scan of the brain to make sure that the cancer hasn't gone into the brain.
Okay. So how long would a typical test take? How long would you know that you have it or not?
It's gotten really good in the past. We had a few challenges along the way. However, these days, the booking for in fact, there are lots of radiological services in the country. And so you can walk into any mammography radiological center and have a mammogram done.
Okay.
And the report is given to you at the end of the day.
Oh, okay.
Exactly. And then once you come into Korle Bu, cancers in general, and breast cancer particularly, is given priority. So if you come and you have any suggestion that it may be a breast cancer or anything related to your breast, you'll be given an earlier appointment and you'll be seen quickly when you go to the hospital.
Okay.
So that shouldn't take too long as well. Maximum a week you would have gotten to see a breast specialist. Then we decide to do the biopsy maybe a day or two after you've seen the doctor. And then the histopathology report comes to us maximum in 2 weeks.
Okay.
So in about a month or less, you would have your diagnosis.
Okay. How often must one go through this?
So for the clinical breast exam, our suggestion is that you should do it every month. Okay. Once you are more than 20 years, every month you should do the examination. And like we said before, close to your period and close to your ovulation may not be a good time because the breast is tender. So some 4 or 5 days after your menses you can examine, or after your ovulation as well, you can do a clinical breast examination. Then for people who are more than 40 years, our suggestion is that once a year or at maximum every other year, you should go to the hospital and have a medical person examine the breast as well, because obviously they do it more often and they are more experienced, so they are able to find abnormalities more than an ordinary person would. Then when it comes to the radiological examinations, elsewhere in the world there are screening programs, and so you'll be home and you get either a telephone call or a letter suggesting that it's time for you to go and have your breast screening, then you go for it. In Ghana currently that's not the situation.
You have to remind your own self.
Exactly. So what we do is opportunistic screening. Someone knows about mammography, comes in to do the mammograph, and we examine it to see. So if you are more than 40 years, you can do the mammogram every year if you are at increased risk. So if you say you have a family member who has breast cancer, or you've had breast cancer in the past, then you do it once a year. Otherwise, you can do it every other year, a mammogram, if you are more than 40 years.
Okay, and the cost involved?
So the mammogram is between 120 and 180 Ghana cedis in Korle Bu. I can't say for the other places, yes, but it's usually below 250 Ghana cedis.
Okay, but your card can't pay. Any of the insurance cards, can they pay?
For mammograms, I'm not too sure, but
you have to try
yes,
and
I have
see.
to find out. Yes.
Okay, all right. Okay, so any other thing you want to add to the information you want to give us today beyond the diagnosis?
I think that today will be a good time to describe how the breast is examined.
Okay.
I can't find Roland. The suggestion was the suggestion was that
yes,
exactly we would use him as
Roland is on the field.
Our guinea pig, no problem.
But you shouldn't be in bra, should you?
No.
Okay.
You should completely be naked.
Okay.
On the top. All right. And the first thing you do is have a look at the breast. So you stand in front of a mirror and have a look at the breast. Look at the size. Has the size changed? Look at the skin. Has that changed as well?
Which means you must be familiar before
That's what
you realize
I keep saying. Exactly. Once you know it, then it's easy to find, oh, there wasn't this funny skin appearance here and now I see it. That's the whole point of knowing your breast. So look in the mirror, have a look at the breast comprehensively. Lift it up. It's your own breast. Be comfortable with it. You lift it up. Yes. Look underneath it. Have a look at the nipple. Look at the areola. Have a look. Are they symmetrical? Is one much bigger than the other? Is the nipple gone in? All of these you have to look and decide if it's normal. Then you need to have a feel of the breast as well. So what you can do is lie flat on the bed and put the hand or the arm of the examining breast underneath your head. Okay. Then the purpose is that you want to examine every single part of your breast. Okay. And one of the things you need to know is that your breast extends into your armpit. So there's a tail of your breast. And then there's what we call lymph nodes, which are quickly involved by tumor if you have breast cancer. And that is in your armpit, where we usually get our boils. So when you're examining your breast, you need to examine the breast, the axillary tail, which is the part of the breast that goes into your armpit, and then your armpit proper. Okay. And the point is that you shouldn't miss any part of your breast. So when you are doing the examination, your hand must coincide with the last part. Do you understand? So there are so many ways of doing it. You can divide the breast into 4 quadrants using your nipple as the center. So you visually divide the breast into 4 and make sure you examine every single quadrant. All right. When you are doing the examination, you must avoid digging, and that's doing this. You can't feel much that way. The other thing you must avoid is using your fingertips. Your fingertips are one of the most sensitive parts of your body. And so if you use your fingertips, you're going to feel all kinds of things that are not, and you'll be scared for nothing. Okay. So avoid using your fingertips and avoid digging. Then using the palmar aspect of the rest of your fingers, you examine all the quadrants in a circular motion. So you touch and then you move it around so that if there's a lump there, you can feel exactly. You can feel the lump. The other way you can do it is to divide the breast longitudinally. And so you examine in a longitudinal fashion, making sure that every single aspect of the breast is examined. Okay. Once you're done with the breast, please have a feel of your armpit. So put your hand in your armpit and examine to see if you can find anything. There are few people who can present with just a lump in the armpit. Oh, okay. And not directly in the breast. Exactly, because what is in the breast may have been controlled by the body, or it may be too small, you can't feel clinically. Okay. Is there a more practical way we can do this? Because we want people to see, and usually I think the complaint is, oh, I don't seem to get it, even though you've taken me through the process. I think the next time I'm coming, I'll come with a dummy. Okay. And then we can do a proper examination of the breast. That will be good. I'll try and see if I can find some materials on that as well. No then problem. We can share. Then you can share. Okay, so we're good to go for today. Yes, we are. Okay, all right. I hope you've been greeting your ladies. Yes, I didn't ask today. Maybe because of where we picked the conversation from today. So I haven't asked if you've checked your breast today, if you've had a feel of your breast today, but I'll certainly ask you that tomorrow morning. I just want to remind you that our conversations on Mondays in relation to breast cancer brought to you with the help of the breast surgical units at the Kolebu Teaching Hospital. Dr. Aite, thank you so much for your time again. This morning we've got 2 more sessions to go because we're doing it the whole month of October. I hope you don't get tired of us though. Oh no, I'm happy to be here. Okay, thank you so much. Coming up next, we've got entertainment coming up here. Always brought to us by Airtel. Stay with us. Becky will be with a lot more details in entertainment. Of course, we're talking Adum Praise. Were you there? If you missed it, well, you just have to sit back and enjoy the highlights, but my bad. It's your pain. Join us next year.